Good afternoon, ladies and gentlemen, and thank you for joining this press briefing. Our expert committee on the safety of medicines, the Pharmacovigilance and Risk Assessment Committee, has now come to a conclusion on the review of cases of blood clots in people vaccinated with AstraZeneca's COVID-19 vaccine. The committee has come to a clear scientific conclusion. This is a safe and effective vaccine. Its benefits in protecting people from COVID-19 with the associated risks of death and hospitalisation outweigh the possible risks. The committee also concluded that the vaccine is not associated with an increase in the overall risk of thromboembolic events or blood clots. Now, during the investigation and review, we began to see a small number of cases of rare and unusual but very serious clotting disorders, and this then triggered a more focused review. Based on the evidence available and after days of in-depth analysis of lab results, clinical reports, autopsy reports and further information from the clinical trials, we still cannot rule out definitively a link between these cases and the vaccine. What the committee has therefore recommended is to raise awareness of these possible risks, making sure that they're included in the product information. Drawing attention to these possible rare conditions and providing information to healthcare professionals and vaccinated people will help to spot and mitigate any possible side effects. We're also launching additional investigations to understand more about these rare cases, and we're conducting targeted observational studies. About 7 million people have now been vaccinated in the EU with the AstraZeneca vaccine, and 11 million have been vaccinated in the UK, and there is increasing use of this vaccine in other countries. It remains very important that all side effects are closely monitored and reported so that we can evaluate them and see if there's any need to update the information and warnings about possible risks. Dr. Strauss will explain the committee's evaluation in more detail, but I want to reiterate that our scientific position is that this vaccine is a safe and effective option to protect citizens against COVID-19. It demonstrated that at least 60% efficacy in clinical trials in preventing coronavirus disease, and in fact the real-world evidence suggests that the effectiveness could be even higher than that. We're very much aware that some member states have paused vaccinations waiting for EMA's outcome of a review. But given that thousands of people in the EU die every day, and in fact over 2,500 were reported one day last week, it really was crucial for EMA to review rapidly and thoroughly all the available evidence. So we made this review our highest priority, and our experts have worked intensively to analyse in great detail all the data available. We have mobilised European experts in the field of thrombosis and blood disorders to investigate, and we've worked closely with other health authorities across the world, including with the UK's MHRA. The scientific conclusions adopted today provide Member States with the information they need to take an informed decision regarding the use of the AstraZeneca vaccine in their vaccination campaigns. Before I hand over to Dr. Strauss, I would like to highlight that a situation like the one we have just seen here is not unexpected. When you vaccinate millions of people, it's inevitable that rare or serious incidences or illnesses will occur in the time immediately following vaccination. Our role in the EU regulatory system is to rapidly detect these incidents and investigate whether there may be a link to the vaccine or whether they are the result of illnesses which occur by chance close in time to the vaccination. We are committed to ensure that any new suspected adverse reactions are rapidly investigated to support decisions based on science, which can then support confidence in vaccines, which is so important in dealing with this devastating pandemic that we are facing. And we remain fully mobilised to ensure our public health role. Today's conclusion helps us to continue in the fight against this pandemic by raising awareness and providing up-to-date information as we have analysed it and as it becomes available, so that citizens across Europe are informed about what they need to do. Thank you very much.
Thank you very much, Ms. Cook. And now I hand over to Dr. Strauss. Dr. Strauss, please.
Thank you very much, Marie-Agnes, and good afternoon. The Pharmacovigilance Risk Assessment Committee, PROC, that I chair, has looked in great detail at the cases of blood clots reported after vaccination with COVID-19 vaccine AstraZeneca. As soon as these concerns arose last week, the committee started a comprehensive review of all the available evidence and working around the clock, making use of all the resources at our disposal. I want to thank the colleagues from the Belgium team that have led this assessment and worked side by side with colleagues from national competent authorities and the European Medicines Agency, as well as scientific experts in blood disorders, who we asked to provide advice in the assessment. The PROC has come to the following conclusions. This vaccine is safe and effective in preventing COVID-19, and its benefits continue to be far greater than its risks. PROC has found no evidence of a quality or a batch issue. The committee has assessed and discussed preclinical and clinical trial data, published literature, and adverse events related to the blood clots that have occurred during the vaccination campaign, reported by vaccinees and healthcare professionals. Critical to the review has been the careful scientific assessment and clinical scrutiny of the individual cases from the different member states. PROC noted that the number of thromboembolic events reported after vaccination is lower than the expected in the general population, and PROC has concluded that there is no increase in the overall risk of blood clots with this vaccine. Moreover, because the vaccine is effective in preventing COVID-19 disease, which in itself is a cause of blood clots, it likely reduces the risks of thrombotic events overall. However, there are also still some uncertainties. We have seen some very rare case reports describing specific unusual events of a combination of thrombosis and thrombocytopenia and bleeding. In a few cases, tiny clots developed in multiple blood vessels in the first 7 to 14 days after vaccination, a condition called disseminated intravascular coagulation. Also, in a few cases, we saw clots developing in blood vessels draining blood from the brain, and this condition is known as a cerebral venous sinus thrombosis. These conditions are linked to low levels of blood platelets, also known as thrombocytopenia, and the evidence we have is at the moment not sufficient to conclude with certainty whether these adverse events are indeed caused by the vaccine or not. So PROC will continue to gather more information on these conditions, including additional studies, and PROC will keep them under very close monitoring. PROC also concluded that it's very important that these events are rare. As of last night, 7 cases of this disseminated intravascular coagulation and 18 cases of cerebral venous sinus thrombosis were reported out of almost 20 million vaccinated people. Furthermore, such cases were not identified in the large clinical trials, but that highlights the importance of being vigilant once the vaccine is administered to large populations. PROC felt also that it is of great importance that healthcare professionals and people coming for a vaccination are aware of these possible adverse events and that they can spot possible signs or symptoms that may occur after the vaccination. Therefore, PROC has recommended to add a warning to the SMPC and the patient leaflet and a description of these cases. so that this information should be provided to healthcare professionals and to the public. EMA and national health authorities will ensure that healthcare professionals and the general public are made aware of this information and made aware of the signs and symptoms of concern so that timely action can be taken to mitigate these risks. And with that, I would like to hand back to Marie-Agnes.
Many thanks, Dr. Strauss.